Hi, I'm Dr. Baraghini, the founder of YourDentalCoach.com, and tonight we are here in New York with Dr. Tarnow. And Dr. Tarnow is a certified, board-certified periodontist and the director of the Department of the Implantology program. So thank you very much, Dr. Tarnow, to join us tonight. And we have...
Welcome to New York.
Thank you. So we have a few questions for you.
Domande?
Domande. We have a lot of domande for you. So why do you decide to become a mentor, first of all?
Well, I love to teach, and teaching for me has always been a great passion. I enjoy sharing knowledge and mostly making people more aware of how to become a better dentist. And so for me, I enjoy teaching carpentry. That's the actual work that we do, the surgery or the prosthetics. But the real challenge is always turning on the mind and turning the intellectual person at a much higher rate. So I always like to, the best dentists always have to have the best knowledge to make the right treatment plan and the right diagnosis. And then they can execute it properly. But teaching requires, in order to teach something and mentor it, you have to know it. So I always challenge myself to try to know as much as I can to be able to give to my students as much as possible. Because for every student that I teach, anywhere in the world, I feel like I've touched a lot of other people, because for every person that they treat extends that knowledge to their patients. And so I feel like I've touched a lot of people indirectly that way. And it's very special for me. I always enjoy teaching.
So how many people do you have in your program for implants?
Well, right now we have at Columbia University, we have a small program of 3 people a year. So we have a total of 6 people at any one time, and it's a 2-year program, and it's 2 days a week for 2 years. And this is the one that's for already people who are trained prosthodontists or specialists already who want to come and cross-train surgically. Probably for next July, we're also going to be starting a 2-year full-time program where the doctors from international places can come over and be part of the AAEG, the Advanced Education Department, and they will learn all of aspects of dentistry, but also be geared to implant surgery and implant training there's like a subspecialty in there. So that'll be a 2-year program. And that also may be structured so that after they finish that, by spending 2 years at a CODA, which is a Commission of Dental Education approved program, they might be able to stay in America if they so desire with a license to teach, license to practice after that.
And do these dentists treat simple cases or complex cases?
Yeah, my implant fellows treat the highest level of cases. Many of them are already prosthodontists, board-trained prosthodontists who want to cross-train surgically. So we treat surgically everything from the simplest cases, of course, right to the most advanced rehabilitations, including, immediate loading, sinus grafting, ridge augmentations. So we do all of that training as part of this. We give them all of that.
So implant dentistry changed a lot, and right now we are using a lot of technology. What do you prefer? What is the tool that you prefer normally?
Well, it's kind of interesting to see what's happening to dentistry and surgery and prosthetics. Certainly CAD/CAM has made, and digital dentistry has become such a major part. However, I think that it's still at its earliest stages. I think that we're getting better at it. I think we're doing scanning intraorally is getting better. I think the technology is going so fast and getting better so fast that I think it will be universal within the next 5 years. I don't think it's there yet. It's still a bit expensive for the average dentist to take on, but it is getting better, and the prices will eventually come down, where it will be routine for everybody to scan their patients and digitally, and for laboratories to be almost completely digital, as some laboratories are already. Some laboratories, as you know already, are almost completely digital and don't even do anything but digital dentistry. I think there'll always be a place for an excellent technician. As I just showed you in our back, we have 9 technicians here. and the beautiful work that we show when we lecture because of these great technicians. And CAD-CAM, zirconium, and Emax, these are all wonderful new materials, but you still need the greatest technicians to do the finest color and the finest staining, and the cosmetic work still is in the hands of the dentist along with a great technician. Certainly a ceramist still will always be necessary.
And in this time, what do you think is the major challenge for dentistry, or in implant dentistry, dentistry in general?
Well, that's a great question. Depends on what part of the world you're talking about, and what country, and even what city or non-city that you're in. For some people, more rural areas, even just preventing people from getting dentures is important. You know, they're still at the point where putting 2 implants in the mandible and giving people a 2-implant overdenture is still the treatment of choice for some patients who can't afford much and have dentures already. In America alone, we have 40 million denture wearers, and that number is astounding, and most of them don't have implants. So I think that there is a challenge. Some of that's education, some of it's finances. But around the world, we know that, you know, fully dentureless mouths should not just be wearing dentures. They should at least have 2 implants to help prevent, to help prevent bone loss in that area, between the mental foramen, and also to give the patient a better quality of life. But I think that's a challenge for the more rural, poorer areas. When you get to the cities, like New York City or some of the major cities in the world, the challenge is aesthetics, speed of wound healing, precision. That's a different type of orientation, but like in our practice, we have patients that are very demanding, of course, as most of around the world in major cities. And people will be very demanding for the highest quality materials, the highest quality service, as well as the highest quality final product. And that includes function and, of course, aesthetics. So I think the biggest challenge that I see is also not forgetting about long-term things. I think the biggest thing that I've seen lately is that everybody thinks that if you put an implant in, it's good for life and we're done. And that's not true. So just like teeth need maintenance, implants need maintenance, even when they're done properly. And I think that the biggest thing is that we're sometimes forget about the long-term effects of some of our treatment. In the past, I think we worked more with that because we were worried about teeth more and crowns lasting. With implants, because it's at least eliminated the number one reason to redo a crown on a tooth is recurrent caries. And we don't have caries on it, we don't have decay on an implant. So it's kind of made us feel like, well, the tooth is good for life. But, we forgot about the periodontal disease. Many people forgot. And this is coming back to bite us a little bit. This is coming back big time. And the longer we wait over time, the more healthy implants are in the mouth, the more some of them will become inflamed. And then we have to treat them, and we're not that good yet at treating them that predictably. Mm-hmm. So the key is to prevent the disease. Yeah. The key is to do proper placement, proper crown contour, lots of attached gingiva, excellent oral health, excellent cleanings afterwards, maintenance by the patient and by the professional. And those basics never go away. And that's what I think we're starting to break into people's heads, that this is still as important as it was for teeth.
So, what is your recipe for success in dentistry?
I always say to my students, gain as much knowledge as you can, learn as many techniques as you can, but then you have to apply them properly to the person sitting in your chair. You might have there's one diagnosis, but there's multiple treatment plans. Yeah. So first you have to be knowledgeable to come up with the right diagnosis, which will lead you to the right treatment plan for that patient in your chair, yeah. Financially, emotionally, physically, how well the patient is. So I think that those are still the number one things that we have to do. But then the next thing you have to do is become good carpenters, good technicians physically. So we have to learn. The best dentists are always the most knowledgeable, but can also have the team around them to execute that treatment plan. Average dentists have one of those two things missing. They might have come up with the wrong treatment plan, but whatever they came up with, they were able to execute it well. Or that's average. Or they came up with the wrong treatment plan. They came up with the wrong treatment plan, but they did it correctly. So they didn't totally ruin the patient. The worst dentists in the world, and thank goodness there aren't many, but they're out there, are the ones that came up with the wrong treatment plan because they didn't have the right knowledge, and they don't have the team to execute it properly. And those are your horror shows that you see. Those are the real terrible cases. And the average is somewhere in between. They have either the knowledge or the hands, or one of the two is missing. And the best, they have both.
So, I have to say that Dr. Tarnow has a wonderful office, and it was an honor for me to have this interview with him. And so, thank you very much, Dr.
It's been my
Tarnow.
honor to see you after so many years. I know you for so many years, and
Yes.
it's so nice to see you back here. Welcome to my office,
Thank you.
and welcome to New York.
So, bye bye to
Ciao.
everybody. Ciao.
Ciao.